Go live to the State House with Governor Brad Little.
Changing hourly. There's now a confirmed case in a new part of the state in Kootenai County in North Idaho. We're receiving confirmation this afternoon that limited community spread of coronavirus has been detected in Blaine County. That means this is the first time in Idaho that a person contracted the virus from an unknown source in their community. Up until now, all confirmed cases were the result of travel to an area outside of the state or from close contact with someone who contracted the virus through travel. At this time, it does not appear that community spread in Blaine County, is widespread. My office and members of my coronavirus working group are fully engaged with South Central Public Health District, Blaine County commissioners, and the mayors in the area to ensure a strong response is in place. Our number one priority is to slow the spread of the virus in that community and outside of it. To ensure that happens, the director of the Idaho Department of Health and Welfare will issue an isolation order for residents in the area. We are still working on the details, and the residents will still have essential services available to them, such as access to grocery stores and, of course, health care. I am firm in my commitment to making decisions in the coronavirus planning and response based on science, not fear. Every step of the way, we have made decisions based on the best information and guidance from CDC, our nation's leaders. Idaho is an expansive and geographically diverse state. Science and common sense tell us that planning and response efforts in one part of the state may not be the best approach in another part of the state. That is why I initially resisted any statewide closure of schools or other establishments. However, I do recognize that the majority of Idaho students are out of school right now based on closure decisions at the local level. My staff and I have been in regular communication with education leaders across the state in recent weeks, and I will continue to work with them in the coming days and weeks to ensure we are meeting our constitutional obligation to, quote, keep and establish and maintain a general, uniform, and thorough system of free common schools. I stress uniform because the remote delivery of education services needs to occur as uniformly as possible in every corner of the state during this time of uncertainty. Idaho has been preparing for coronavirus since January, when the first case was confirmed in the United States. Since then, we have been communicating and coordinating with schools, businesses, many players in our healthcare and emergency response chain to ensure we are asking all the right questions and opening doors to resources. I urge everyone to be even more vigilant of the preventive measures we can all take to slow the spread of coronavirus. And most of all, I continue to urge Idahoans to take care of each other. Be mindful of our actions. Find someone you can help. We will get through this together. With that, I'll take your questions. Betsy.
Governor, with the community spread in Blaine County, how many of those affected have been healthcare providers?
The question is, with the spread in Blaine County, how many have been healthcare providers? I believe the number is 2. We're aware of 2. Yes.
Governor, what exactly does this isolation order entail?
Well, it actually is similar to the advice and counsel I gave everybody yesterday, but now it's mandatory. Yes.
How many cases in Blaine County?
The total cases in Blaine County, I believe, are 16.
You mentioned that steps have been taken since January to fight coronavirus. Can you explain what some of those early steps were?
The question is what steps have been taken. We've done so many of them, I know I can't count them all off. But we have stood up. Obviously, we have 3 different task force. We have one on that's overall task force. I was on the phone today with the president and the vice president. I'm on the phone about every second, or matter of fact, I'm supposed to be on a phone call with governors right now, and we're taking the best practices that exist in every state and implementing here. There's 3 things that are really critical to us. One is healthcare personnel, but that personnel has to have what they call PPEs, personal protection equipment. We are working through every single supply chain to make sure that's available. But very critical is daycare for healthcare workers. We're working through lots of options in that, but the most critical part of our best line of defense is first personal responsibility, distancing, good hygiene, but maintaining the quality and the trajectory of my healthcare system, and those are the 3 things. But those have been things that we started about in January, and they've just been accelerating. I have literally spent all day long in meetings talking about this issue.